SJT, there's two types of questions, right? So we have the ranking questions where you're presented with a STEM and 5 options, and you rank the options against each other from the most appropriate to the least appropriate. And we have the second type of question where you have a STEM with 8 actions, and you select the best 3 actions to take out of those 8. So which 3 actions are the most appropriate out of the 8? I've already said this. Please don't leave SJT prep in the last 2 weeks before the exam. That's not recommended. It's made up of, it's SJT contributes 50% of your overall mark with the MSRA exam, so it deserves 50% of your time and attention. So, a lot of people, I've recommended this too, but you can really turn SJT into your secret weapon because unfortunately it tends to be ignored by lots of people as they are preparing for the clinical part of the exam and leave SJT right at the end. I wouldn't recommend this. I certainly would prepare for it all the way through. Dr. Ahmed already covered the SJT course day and the clinical course day, so I won't go through that again. Now, the SMART framework. Anyone who's been to our previous webinars will know about this. It's essentially a framework developed by the team in order to help strategize SJT questions. What it encourages you to do is when you are reading an SJT STEM, you should always prioritize the ethical principle that this question is based on over any other ethical principle there is. So when reading the STEM, you decide what's the main ethical issue that this question is testing me on. Is this a question testing me on teamwork? Is it a question testing me on communication? Is it a question testing me on professionalism? And once you've decided the ethical principle, you prioritize that one when ranking your options over the others. You then identify the stakeholders involved and make sure the actions you've selected as the most appropriate satisfy those stakeholders. You then rank the actions against each other. So we move on to the A component of SMART. You rank the actions against each other. You then make sure all of the actions have been reasoned against the available GMC guidance, and then overall you come up with a tailored judgment. So we'll apply this to the questions we will see now. These are the main themes that tend to come up for the SJT exam. So the first theme is patient safety and escalation. These are the types of questions that tend to come up. You then have autonomy and consent. Usually this is focusing on ages on either end, either extremely young patients or very old patients who perhaps lack capacity, and then patients who do have capacity, but there are issues with autonomy and consent. Confidentiality and keeping patient records is another theme that tends to come up of questions. Probity and professionalism is a huge one that always comes up. Complaints and governance is also a really big one. So these are the types of questions that don't necessarily involve a patient directly, but these are the types of questions that they tend to ask about. And then professional boundaries and relationships. The next one is teamwork and communication is also another big theme that tends to come up in the SJT exam. So the first question that we're going to go through, you're the F1 covering the acute medical ward, and Mr. Hall, a 68-year-old man admitted with worsening breathlessness, has had preliminary imaging that may suggest a new lung mass. The formal CT report is not yet available, and as you finish reviewing the observations for a neighboring patient, Mr. Hall quietly says, "Doctor, I can tell something serious is going on. Is this lung cancer?" And these are the options we have. So these are 5 options. So the main ethical principle here is communication and breaking bad news in a safe, honest manner, especially since this is a potentially life-changing diagnosis. The main stakeholders involved would be the patient, of course, who's extremely anxious and vulnerable in this case, you as the doctor, the senior medical team, and perhaps anyone else available. But in this STEM, they've only mentioned you yourself, the patient, and the senior medical team would be involved in the answer. You then rank the available actions. You reason based on the GMC guidance to deal with this, and we come up with a tailored judgment at the end. Now, breaking bad news. Let's go into more detail about this ethical principle and how it helps us to get to the right answer. Breaking bad news does fall under the branch of duty of candor, essentially. So it's communicating serious or potentially life-changing information in a safe, truthful manner towards the patient. Mr. Hall, in this case, does suspect a diagnosis of lung cancer, but it's not yet confirmed. So the question is really asking us is how do we respond as a junior doctor, F1 or F2, towards a patient asking for such an important piece of information? And we have to prioritize this ethical theme over the others. So we've already seen the SMART framework for this. The ethical principle is breaking bad news, which knowing this helps you to rank the options because you're going to rank them according to the guidance of breaking bad news, which the GMC is very clear on. So we've already said breaking bad news falls under the umbrella of duty of candor. So duty of candor also encompasses questions to do with telling patients about mistakes that have happened in the workplace. So that also falls under the same umbrella of questions. They're handled in the same way, which is when a mistake has happened in the care of a patient, you should also have a duty of candor discussion led by a senior member of the team. So honesty and duty of candor, staying within competence and avoiding harm. So you should only divulge information to patients within your competence. And as an F1 or F2 member of the team, breaking such news about a heavy diagnosis would not be within our competence, and then ensuring sensitive senior-led communication. So the GMC guidance on this. You must be satisfied that you have the necessary knowledge of the patient's condition and the options for investigation or treatment in order to give them the information they need, which most of the time would be a senior member of the team. It would be a consultant who has knowledge of the condition. And then you must ask for advice and support from a colleague when you need it, when it comes to breaking bad news for patients. So these are the direct guidance from the GMC topics on this.